Now I call upon Dr. M. Rita, who will be talking on outcome of corneal tattooing in patients with total corneal opacity in a tertiary care center.
Good morning to all. My topic is outcomes of corneal tattooing in patients with total corneal opacity. The aim of the study is to determine the safety, efficacy and complications associated with corneal tattooing and to explore the patient's satisfaction and improvement in self-esteem. It's a prospective cohort study conducted in a government tertiary hospital in Tamil Nadu. This followed for 5 years. And the technique used is, it is a lamellar keratectomy with the surface impregnation with filling of the dye within the chamber. And this is a small video showing this corneal opacity with no perception of light, only for the cosmetic purpose. To the side port, the corneal spatula, it is inserted and the pocket is created in the corneal stroma. So in this case, so synapse is there, adherence is there. So we can't go from the single side. So another pocket is created in the opposite side with a crescent blade. And again the corneal spatula is introduced. And the uniform pocket, stromal pocket is created. And we are filling the dye within the stroma. And the wounds are closed with the 10-0 nylon. And the chamber is tight. So in this patient, so cornea band-shaped keratopathy is there. So we prepare EDTA and keep it for 3 minutes. And it is removed, scrape it off with the cotton bud. Still in this case it is not going. So we, with the crescent knife, it is scrape it off. So again the dye is applied over the raw area. The bandage contact lens is kept. So this is a post-operative outcome of the patient. So methodology we used is pre-operative evaluations and patients with complete total corneal opacity with no visual acuity were selected, and the baseline score of Rosenberg self-esteem scale in the native language we filled up. Then the procedure we did. Then the post-operative assessment. This is also we have to fill the self-esteem score at 1 month, 3 month and 6 months interval. So patients are followed weekly for 1 month and monthly for 6 months and assessed for complications like infection, corneal erosion and fading of dye, etc. The satisfactory score by Rosenberg self-esteem scale for assessing the improvement in self-esteem of the patient is assessed in every week. So the Rosenberg self-esteem scale is the most popular scale. It consists of 10 statements about feeling of self-worth and self-acceptance, to which the respondents indicate their level of agreement on a 4-point scale. Normal score range from 0 to 30. So this is the scale. We have converted it into the local language. And the score between 15 to 25 is normal. Scores below 15 suggest low esteem. And this is a graphical representation. So before the procedure and after the procedure, that shows a gradual increase in the self-esteem. So this is a pictorial diagram. And the efficacy, it is very simple and cost-effective procedure with minimal complication, no fading of colors, cosmetically good outcome with good satisfactory effect. So adverse effect, almost all the patients have pain and redness in the first week of post-operative period. It was treated with antibiotic and steroids and lubricating eye drops. And summary, no participants were found complications during the study period. Overall, the impact of corneal opacities on self-esteem is multifaceted, encompassing both cosmetic and functional aspects, addressing the psychological effects of corneal opacities in addition to their physical effects, which is important in promoting the well-being and quality of individual's life. So there are few limitations. There is only 3 patients score was less than 15. Maybe it is because of the color difference between the 2 eyes. So we plan to rectify this by using different shades of dye in the upcoming patients. These were my references. Thank you. These are some of the patients.
How did you prepare the dye? Is it commercially available?
Yes, sir.
Your charcoal mixed with something?
Yeah, it's commercially available, sir. Rami, sir, you can get it, sir.
Okay.
And what's the maximum duration of follow?
5 years follow-up is there. Still it is there, sir.
Still it is there, 5 years.
Still it is there. No fading, nothing. No
technique that you mentioned in the slides spoke about surface impregnation along with pocket wash with the dye. Whereas the video that you showed a pocket wash of the dye, but you just flooded the dye on the surface.
Yes.
The dye which is flooded on the surface will never stay. If you have opacities on the surface, you need to actually do the puncture technique either manually or mechanically for the dye to stay. If you're just inserting the dye in the pocket and you're just doing a superficial keratectomy and flooding some dye on top and putting the bandage contact lens, the superficial dye will fade off in just 1 or 2 days' time. The verbal part said it correctly.
This one patient only I did. My other cases only total corneal opacity. That's cosmetically still it is there. No fading, nothing.
No, the point that I'm trying to make is if you have surface opacities,
Yes, ma'am.
you need to deepithelize and do the impregnation technique.
Yes, ma'am.
Just painting the dye and putting the bandage contact lens will not make the dye stay. I think you mentioned it in that way in your slides, but what you showed was
Yeah,
slightly
yes.
different.
What's your sample size, ma'am?
20, ma'am.
20.
20.
Did you see any allergic reaction or any kind of hypersensitive reaction? Hypersensitive reaction to the dye? Allergic
No,
reaction.
nothing is there, sir. All the patients are comfortable.
I think we'll